medicine. The lecture covered a range of topics, from the physiological functions of vitamin D to its impact on various health conditions, sources, deficiency risks, and treatment options. Introduction to vitamin D. Vitamin D, often referred to as the sunshine vitamin, is a fat-soluble vitamin that is essential for several key biological processes in the body. Unlike other vitamins, vitamin D can be synthesized by the body when exposed to sunlight, specifically ultraviolet B, UVB radiation. However, due to lifestyle changes, geographical location, and dietary habits, many individuals are unable to produce sufficient levels of vitamin D, leading to widespread deficiency. Dr. Akram emphasized that vitamin D is not just a nutrient, but also a hormone, produced in the skin through the action of sunlight on cholesterol. It is then converted in the liver to its active form, calcitriol, which plays a critical role in regulating calcium and phosphate metabolism. The role of vitamin D in bone health. The most widely recognized function of vitamin D is its role in promoting calcium absorption in the intestines, which is essential for maintaining healthy bone and skeletal systems. Dr. Akram explained that without adequate vitamin D, the body cannot absorb sufficient calcium from the diet, leading to weakened bones and increased susceptibility to fractures and bone-related diseases. In children, vitamin D deficiency can result in rickets, a condition characterized by weakened bones, skeletal deformities, and delayed growth. In adults, a deficiency can lead to osteomalacia, which involves softening of the bones, and increased risk of fractures. Osteoporosis, a condition that leads to brittle bones, is also linked to insufficient vitamin D levels, particularly in postmenopausal women and the elderly. Dr. Akram stressed that proper intake of vitamin D is vital during all stages of life to support bone mineralization, prevent fractures, and maintain bone density. He also mentioned that vitamin D's role is complementary to calcium and magnesium, which work together to ensure bone strength. Immune system support. Dr. Akram delved into the emerging research showing that vitamin D plays a crucial role in the functioning of the immune system. It helps modulate immune responses and strengthens the body's defense mechanisms against infections. Vitamin D receptors are found on immune cells, and the active form of vitamin D enhances the pathogen-fighting effects of these immune cells, particularly macrophages and dendritic cells. The professor discussed how vitamin D helps reduce the risk of infections, such as the common cold and flu, by enhancing the production of antimicrobial peptides. He also mentioned studies suggesting a potential link between adequate vitamin D levels and a reduced risk of autoimmune diseases, such as multiple sclerosis, rheumatoid arthritis, and type 1 diabetes. Dr. Akram highlighted the importance of maintaining adequate vitamin D levels, especially in regions with low sunlight exposure, as this could play a critical role in preventing immune-related diseases and promoting overall immune health. Cardiovascular health. One of the significant aspects of Dr. Akram's lecture was the growing body of evidence linking vitamin D deficiency with an increased risk of cardiovascular diseases, including hypertension, coronary artery disease, and heart failure. Research has shown that individuals with low vitamin D levels are more likely to suffer from cardiovascular conditions, possibly due to vitamin D's role in regulating blood pressure, reducing inflammation, and improving endothelial function. Dr. Akram explained that vitamin D helps regulate the renin-angiotensin system, which plays a vital role in controlling blood pressure. Deficiency of vitamin D has been associated with an increased production of renin, leading to elevated blood pressure. Additionally, vitamin D has anti-inflammatory properties, which can help reduce chronic inflammation, a key factor in cardiovascular diseases. Cancer prevention and management. Dr. Akram provided insights into the potential role of vitamin D in cancer prevention and management. Studies have shown that adequate levels of vitamin D may reduce the risk of various cancers, including breast, prostate, and colon cancer. The active form of vitamin D acts as a regulator of cell growth and differentiation, and it has been shown to inhibit the growth of cancer cells by promoting apoptosis, programmed cell death, and preventing angiogenesis, the formation of new blood vessels that feed tumors. He mentioned that while vitamin D may not directly cure cancer, maintaining optimal levels may help in cancer prevention and improve the overall prognosis when used alongside conventional treatments. Dr. Akram recommended further research to explore the full potential of vitamin D in oncology. Sources of vitamin D. Dr. Akram provided an overview of the primary sources of vitamin D. These include 1. Sunlight. The most natural and effective way to obtain vitamin D is through exposure to sunlight. Ultraviolet B, UVB rays stimulate the production of vitamin D in the skin. However, factors such as geographical location, season, skin pigmentation, and the use of sunscreen can limit the amount of vitamin D produced by the body. 2. Dietary sources. Vitamin D is found in few foods, and dietary intake alone is typically insufficient to meet daily requirements. Foods rich in vitamin D include fatty fish, such as salmon, mackerel, and sardines, liver, egg yolks, and fortified foods like milk, cereals, and orange juice. 3. Supplements. For individuals with limited sun exposure or dietary intake, vitamin D supplements can be an effective way to ensure adequate levels. Dr. Akram discussed the two main forms of vitamin D supplements, vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol, with vitamin D3 being more effective in raising blood levels of vitamin D. Risks of vitamin D deficiency. Dr. Akram highlighted several risk factors for vitamin D deficiency, which include limited sun exposure. Individuals who live in regions with long winters, or who spend most of their time indoors, are at a higher risk of deficiency. Age. As people age, their skin becomes less efficient at producing vitamin D from sunlight. Older adults are also more likely to have limited sun exposure and dietary intake. Skin color. People with darker skin have higher amounts of melanin, which reduces the skin's ability to produce vitamin D from sunlight. Obesity. Vitamin D is stored in fat cells, so individuals with higher body fat may have lower levels of bioavailable vitamin D. Symptoms of vitamin D deficiency can be subtle, but may include fatigue, muscle weakness, bone pain, and an increased susceptibility to infections. In conclusion, Dr. Muhammad Akram Tatri emphasized that maintaining adequate levels of vitamin D is essential for overall health. He encouraged students, faculty, and the broader community to focus on a balanced diet, safe sun exposure, and, where necessary, supplementation to ensure optimal vitamin D levels. By understanding the critical functions of this vitamin in bone health, immune function, cardiovascular health, and disease prevention, individuals can make informed choices about their health. Dr. Akram's lecture provided a comprehensive understanding of vitamin D's significance and its applications in both traditional and modern healthcare practices. His emphasis on preventive health and the integration of Eastern and Western medical approaches made the lecture a valuable resource for all attendees. Would you